There's a lot of variety in urology, and there's many different conditions we treat, whether it's curing men of cancer, treating kidney stones, or helping men with their enlarged prostates. There's always something different. That variety continues to excite me, and additionally, all the technology and progress that we've been making in urology is an exciting field to be in. I would first let them know they're not alone. Having urinary symptoms or symptoms for your prostate are incredibly common. So coming in, talking with a urologist, we can go over all your symptoms and help you in any way possible. So HoLEP stands for Holmium Laser Enucleation of the prostate. It's becoming the new gold standard treatment for enlarged prostates. It uses a scope and a laser. It's completely minimally invasive. The procedure is done through the urethra. We find the natural plane between the prostate and its capsule and essentially enucleate the prostate. So we follow that natural plane and push out all the obstructing tissue, so you have a big open channel. This helps reduce urinary symptoms, gives you a stronger stream, and helps get you off prostate medications. And additionally, by finding the natural plane of the prostate, there's less bleeding with this procedure. The capsule is also fibrous, so by removing the obstructive tissue of the prostate, there's a decreased chance of regrowth, meaning that this is a procedure you likely only need once in your lifetime. If you feel like your stream's not as strong as it used to be, if you're waking up at night, if you're getting an urge that you have to run to the bathroom, if you're feeling like you're urinating too often, if you're having some discomfort with urination, or even some leakage with urination, those could all be signs that you have an enlarged prostate or an obstructing prostate. HoLEP is sort of special because it can be done for a prostate of any size. Finding that natural plane where we carve down to the capsule makes the risk of bleeding lower compared to others, and additionally, the rates of retreatment after HoLEP are decreased compared to all other procedures. Since HoLEP is a size-independent option, all patients are candidates for HoLEP. HoLEP can either be a same-day surgery or a one-night stay in the hospital. I normally keep a catheter one night, and if your urine's clear the following morning, we remove the catheter. As the area heals, you can expect some urgency and frequency. I normally say give the area 3 months to fully heal and see where your urinary symptoms are. The other symptoms of HoLEP postoperatively are similar to other prostate procedures. Some blood in the urine, potentially some urgency, frequency, and potentially some temporary stress incontinence, where if you lift something heavy, there could potentially be a little bit of leakage. For the vast majority of patients, that is temporary and resolves within 3 months, if not sooner. We do urinary symptom scores, and from those ejected data, we've seen that quality of life dramatically improves, whether it's urinating less frequently, having a stronger stream, feeling that you're fully emptying your bladder, or for patients that are catheter dependent, we're getting many men urinating again. Everyone is different, but there are so many options we have now that we can get you urinating to a level that is less bothersome. Whether it's medications, treatments, procedures, there's so many options now that there's always something we can do to help you urinate better and make sure your urination doesn't get worse. Seeing the dramatic improvement in quality of life afterwards. I meet many men that are struggling with their urinary symptoms, waking up 7-8 times at night, or even a lot of men who have had catheters in place for over a year. We're giving men their lives back by dramatically improving their quality of life and helping reduce these urinary symptoms.